treatment for apraxia speech needs to be very intense. And so we recommend that children receive therapy anywhere from 3 to 4 or 5 times a week. And so, and depending on their ability to attend, how long those sessions are, they might be 20 minutes, they might be 40 minutes, they might be an hour. But that intensity is required, especially when they're first starting to learn to sequence those sounds. The therapy is very movement based, so we're not trying to teach them how to make a sound and like let's put our tongue in the right place and make a sound. That's not what our treatment is. The treatment needs to help them transition and go from one sound to another sound. So it's that movement that we do in speech that you and I don't think about. But for them, when they try to do that movement, their tongue gets in the wrong place, their lips are too far opened, or the motor plan that we have to have for speech is what they lack. And so our treatment teaches them those motor plans and how to put those sounds together to form words. So we rely on a very structured type of treatment. So it incorporates the principles of motor learning, which kind of give us a structure about how much practice, how we organize that practice within our therapy session, what kind of feedback we give and how frequently we give it, what rate we're practicing our target sounds or words that we're doing. And so, and then we provide a lot of cueing and multisensory cueing to really help support the child. And then as the child gets more proficient, we fade those cues out as quickly as we can so that they're producing the motor pattern on their own. And then the target is that we work on are very specific. We usually have a small set of targets, 3 to 5 to 6 words that we work on at one time so that we can really focus on those motor plans. And they're different motor plans that we're working on at the same time. And then we also incorporate prosody and how to the natural flow of language and speech. And so the intonational patterns and things, we have to actually help them figure out how to do that, because that's part of the motor plan that you and I use when we raise our intonation. If we're excited or ask a question or something like that, they have a difficult time programming that, as well as programming what my tongue's doing, what my mouth's doing, is my voice on or off. So there's lots of layers to a motor plan for us to say a word that you and I don't think about, but for them, it's very difficult. We do have some therapy protocols or treatments that have some evidence base behind them to say that they are very effective with children with childhood apraxia of speech. And so those are the ones that we would routinely recommend or look at using with a child when we're first starting out with our intensive treatment with them.